Common early signs of pregnancy. Have you been feeling a little different lately? Maybe your body is trying to tell you something. Pregnant woman. Today, we're diving deep into the early signs of pregnancy, the subtle and not so subtle changes that might be your body's first whispers that a new life is beginning. Whether you're trying to conceive or just curious, this video will guide you through the earliest signs many women experience, sometimes even before they take a pregnancy test. Let's begin. 1. Missed period, the classic signal. For many, a missed period is the very first obvious sign. If your cycles are regular, a late period might immediately raise suspicion. But did you know, some women experience light spotting around the time their period is due? This is known as implantation bleeding. It occurs when the fertilized egg attaches to the uterine lining, and it's usually lighter, shorter, and more pink or brown than a normal period. So, don't rule out pregnancy just because you noticed some spotting. 2. Tender, swollen breasts. One of the earliest physical signs. Your breasts may feel sensitive, sore, fuller, or heavier. This happens because of the sudden rise in hormones like estrogen and progesterone right after conception. The areolas, that's the area around your nipples, might darken and even become larger. Some women even notice tiny bumps on the areola becoming more prominent. Those are called Montgomery's tubercles, and they help prepare the breasts for breastfeeding. 3. Fatigue, that deep, bone-tired feeling. Feeling extremely tired even after a full night's rest. That's early pregnancy at work. Increased levels of progesterone, along with extra blood production, drop in blood sugar, and lower blood pressure, can leave you feeling exhausted. This isn't your regular kind of tired, this is a deep, sleepy, can't keep your eyes open kind of fatigue. It's your body's way of conserving energy for the big task ahead. 4. Nausea and morning sickness. Despite the name, morning sickness can happen any time of day or night, and for many women, it begins as early as week 4 to 6 of pregnancy. Some experience mild queasiness, others may have full-on vomiting. It's all thanks to human chorionic gonadotropin (HCG), the pregnancy hormone, along with rising estrogen levels. Interestingly, nausea is sometimes more intense in women carrying twins, due to higher hormone levels. Pro tip: eating small, bland snacks throughout the day and staying hydrated can help ease the queasiness. 5. Frequent urination, running to the bathroom more than usual. This symptom can start very early, sometimes even before your missed period. Pregnancy causes the kidneys to filter more fluid due to the increased blood volume. Your growing uterus can also begin pressing on the bladder, even in the first trimester. It's perfectly normal, just make sure to drink plenty of water to stay hydrated. 6. Mood swings. If you've been riding an emotional roller coaster, don't worry, you're not alone. Pregnancy hormones can cause sudden mood changes. One moment you might be laughing, and the next, crying over a commercial. These mood shifts are especially common in the first trimester, similar to PMS, but sometimes more intense. Be gentle with yourself. Emotional sensitivity is a normal and natural part of early pregnancy. 7. Food cravings and aversions. Suddenly craving pickles and ice cream. Or can't stand the smell of your morning coffee. Hormonal changes can drastically affect your sense of taste and smell. Some women develop strong aversions to foods they once loved. Others crave things they never liked before. These changes are completely normal and usually settle down after the first trimester. Just be mindful of what you're putting into your body, and try to choose balanced options when possible. 8. Bloating and cramping. That period is about to start, feeling might actually be early pregnancy. Hormonal changes can cause your digestive system to slow down, leading to bloating, gas, and mild cramping. These cramps may feel similar to menstrual cramps, but they are usually milder and associated with the uterus beginning to expand. If you notice severe pain or bleeding, always check in with a healthcare provider. 9. Basal body temperature stays elevated. If you've been tracking your basal body temperature (BBT), the temperature of your body at rest, you may notice it remains high even after ovulation. This sustained rise is due to progesterone and is one of the earliest signs that pregnancy may have occurred. It's subtle but meaningful if you're tracking fertility closely. 10. Light spotting, implantation bleeding. As mentioned earlier, around 6 to 12 days after ovulation, some women notice light spotting. It's usually pinkish or brownish in color, lasts a day or two, and is completely harmless. This is different from your normal period, much lighter and not enough to fill a pad or tampon. 11. Constipation. Early pregnancy hormones slow down the digestive tract to help your body absorb more nutrients, but that can lead to constipation. Staying hydrated, eating high-fiber foods, and staying active can help. 12. Headaches and dizziness. Some women experience mild headaches, dizziness, or lightheadedness in early pregnancy. These are often caused by lower blood pressure and increased blood flow. Getting up slowly and eating small, frequent meals can help manage these symptoms. Final thoughts. So there you have it, the early signs of pregnancy, from the obvious to the unexpected. Remember, every woman, and every pregnancy, is different. Some women feel all of these symptoms. Others feel only one or two. And a few might not feel anything at all until later. The only way to know for sure is by taking a pregnancy test and confirming with your doctor or midwife. Baby, if you found this video helpful, give it a thumbs up, and don't forget to subscribe for more women's health and wellness content. If you've experienced any of these signs, or have a story to share, we'd love to hear from you in the comments below. Thanks for watching, and take care of yourself.